Palm Desert. They're inviting the public to attend an event that aims to show support for ethical and patient-first care. I spoke today with cataract surgeon Dr. Keith Tokuhara. All right, Dr. Tokuhara, tell us about tomorrow's event and why it's important.
Tomorrow, we're having an event at Hotel Paseo about ethics in eye care. It's important because we have a large community of patients in the valley that are in that cataract age group, and a lot of people don't know it, but in some instances, financial incentives for doctors to refer patients for cataract surgery. So we're trying to spread awareness in this growing movement. We're also inviting patients, business leaders, and other doctors in the area to join us on this event to make a public signing of a pledge for ethics in eye care. You see, we want to bring transparency back to eye care to really bring up that trust with our patients.
So for folks who aren't familiar with this issue of kickbacks and financial incentives, how does that work?
Well, cataract surgery is a Medicare procedure, but of all the specialties in cataract surgery, there are upgraded lenses or lifestyle lenses. For the surgery, we can use a better lens that does astigmatism correction, for instance. And in some practices, there's a financial incentive to refer to some of the doctors that will pay a kickback or a co-management fee for that procedure. So it's an unusual subcategory in Medicare where this occurs. And last year, there was some big settlements in the news about the OIG cracking down on practices that are involved in this kickback scheme or co-management scheme. And I think the OIG can't really track all the doctors that are involved or all the practices that are involved in this. So what my idea was, let's educate the community, let's bring this out in the open so we can really bring that transparency. So you don't have to wonder if this is something that your doctor is involved with or not.
And you don't have to name names, but are there local doctors doing this?
Well, I can tell you that in Coachella Valley, it has been told to me by patients that this occurs, but obviously I am not involved with it. And my idea is, instead of looking at the bad side, let's look at the positive. Let's sign a pledge for anyone that wants to participate to say no to that, to say no to kickbacks, so we can bring transparency back to healthcare. And patients that want to sign the pledge to support this movement, or doctors, we can all join this movement to say, let's be honest and transparent about how we're dealing with these referrals for cataract surgery.
I think it's commendable that you are putting patient care first and trying to bring transparency into your industry. Why is this so important for you?
Well, we want to make sure patients get the surgeon that they need, not the surgeon that's dictated or maneuvered around these under the table business deals. And I think we want to make sure our patients get the best care that they need, not something that has a business arrangement or some other incentive behind it. You want to have a partner with your surgeon, you don't want to have your partner should be your surgeon, not the business or the corporation that's behind the referral pattern.
Anything else, Dr. Tokuhara, you would like to say about all this in tomorrow's event before we let you go?
Well, come join us. It's from 10 to 11:30. Everyone's invited. We'll talk more about it when we get there.
Okay, Dr. Tokuhara, we appreciate your time. Thanks so much for joining us.
Thank you for having me.
All right, coming up, trying to